Removing the bonded rapid palatal expander can be difficult, but in most cases using a posterior band remover will break the bond from the tooth. Care and case selection must be made before bonding to check for a severe lingual undercut, which when present in some adult patients will prevent removal by this method. In those cases, adhesive can lock into those lingual undercuts, requiring a sectioning of the appliance with burrs, a procedure that is uncomfortable for the patient and operator. Remove excess adhesive from a teeth with a burr or a curette. In some cases where primary teeth are present in 11 to 12-year-old patients, extraction of teeth may take place if root resorption continued during the 4 months of treatment. Be particularly careful not to select cases with more than 1/2 of the roots already resorbed for rapid palatal expansion because anchorage to the maxillary bases may not be sufficient. Expect the tissue to be irritated on the palate. This irritation will return to normal in 2 to 3 days. Now the first molar bands may be fit without separation. Then like sheaths may be welded and a transpalatal arch fit for the maintenance of the expansion. In our office we have bands already pre-made for this purpose. If you do not have the capabilities of welding, an alternative method is to take an alginate impression of the pre-fit bands for lab fabrication or without bands for Hawley retainer fabrication. In either case, the bonded expander can be re-cemented in place with crown and bridge cement until the necessary lab work is completed. The bands are cemented with your usual crown and bridge cement. In this case, the anterior teeth had been previously leveled and aligned while the expansion was taking place. A full arch wire may now be placed with the bands in place. Retention with the transpalatal arch may be for several years if the patient was young. In adult patients, the transpalatal arch may be removed as soon as heavy arch wires are engaged in the brackets, usually at 19 by 25 stainless steel wire. The arch wire then can maintain the established width. I will now fabricate the transpalatal arch from the pre-formed transpalatal arch blanks in the office, curving the palatal portion to fit the palate as close as possible. The arch will be made to fit passively, being used to maintain the width only. We may sometimes also use the transpalatal arch to control the torque of the teeth, or the toe end of the molars. Using an angle half plier, you can adjust the torque and the toe ends on the transpalatal arch. Next, you should insert one end only and observe the opposite end to see what action is on the transpalatal arch. Our transpalatal arch is the method of choice for retention of rapid palatal expansion.